make sure you look at a bone density scan, make sure you're not having brittle bones when you're going on these and losing weight. And people are just going on them, as you said, without checking their electrolytes. Cardiac patients, you can get rhythm problems.
30 to 50% of the people who take a GLP-1 stop the medication within 1 year. A lot of times it also is cost prohibitive, right? So if your insurance is not covering it because you didn't meet the criteria for the medication.
Hello, ladies and gentlemen. The title for today's podcast is Check Yourself Before You Inject Yourself. I'm Dr. Scott.
And I'm Phil.
Phil, the reason we're doing this today is this is hot off the presses. This is something that you and I, before we even started this was one that we've said we got to do.
Absolutely.
Right? So the reason it's just crazy right now is because 1 out of 8 Americans has tried a GLP at this point. And if you look back at the history of this, which we'll talk a little bit about, in 2019, before the explosion, going all the way to 2023, it was like a 700% or over a 700% increase in usage of this. Yeah. It's crazy.
It's a lot of people. It's a lot of people
So
using GLP.
before you hop on the GLP train, we're here to tell you that if you want to go on this medication, you got to be aware of the consequences.
It's true. And there are some benefits too. So it's not all
Absolutely.
negative. We're going to talk about both today.
Yeah. So
and I think people really need to understand there's no judgment in this episode. So we're not judging if you are on it or if you're thinking on it. We really just want to bring you the facts and make sure that if you are taking it, you do understand what's necessary. Yeah. There are consequences and there are benefits as well, just so you're well informed.
Well, let's roll right in. What is a GLP?
A GLP is a natural hormone that your gut produces after a meal. And it's really important because this particular hormone tells your brain if you're full. It slows down your digestion. It helps the pancreas take up insulin, release insulin so that your blood sugar stays consistent. And it supports weight management. So it's a really big deal. But we do make our own body makes it naturally in the gut after a meal.
Okay. So that works. And we know it works and it has such benefits. And as we're going to talk about, some issues that you need to be concerned about. But so before we go into detail, why don't we talk about the description that you just gave in a way, because again, if we're going to talk about some of the bad things, you need to know this. So let's just think about your body as a bank. And instead of food, you're storing energy, okay? And food is your deposit. Now, when you need energy, you're depositing that as sugar, right? And basically, it's your savings account from that standpoint. So think of glucagon, just like you were talking about, as kind of a messenger. As you said, it's from the pancreas. Think of it as the bank teller. And in this case, it's giving you energy, okay? Glucagon-like peptide, it's a special type of helper, if you will. And the way I usually describe it is as like a car. And when you're driving your car, you have a gas pedal and you have a brake pedal. The gas pedal, in this case, if you hit the gas, you're hungry and you store fat. If you hit the brakes, you basically stop eating and you burn fat. So what glucagon-like peptide does is it fixes the gas pedal and applies the brake. And so basically, when you hit the brakes, you clean up the mess.
And when it's working as it should, you have steady energy, you have fewer cravings, and you have much better blood sugar control.
Well, and which leads us to, what are the benefits of this? Number one, diabetes, right? Yeah. That's what it was originally intended for. This was actually, it came out, 2005? I didn't see a lot of prescriptions. I don't think there are a lot of prescriptions at that point for diabetes. Really, only the endocrinologists were writing for them back then. It wasn't us cardiologists and maybe even less primary care doctors. And in 2022 was when this big explosion occurred. And what happened was that one of the drugs showed at least a 15% a drop in body weight, and then the next one showed about a 20% drop in body weight. And so that's where this...
You're talking about studies?
Yeah, the studies that came out. And so that led to all this increased prescriptions and the cover of Newsweek or Time magazine. So this is what led to it. But the next thing was, and the big thing that came out over the past couple of years was the cardiovascular benefits. And the reason is that there was this 13 to 26% drop risk reduction in what we call major adverse cardiac events, and that's dying from stroke or heart attack or just the overall dying. And this was also found in people that weren't diabetic. So this was a big deal. If you were overweight and you got placed on this, you got a benefit in terms of dying and stroke and heart attack. In addition, there was over a 20% drop in all-cause mortality, dying from anything, cancer, etc. A lot of these things have been looked at. Lately, also, people who have heart failure, their symptoms are improved and their hospitalizations for heart failure are also reduced.
Let me just ask you a question. Are those only in people who meet the criteria for the medication?
Yeah, and that was the big thing. You and I have discussed this. That's a big thing, folks. That's one of the reasons why it's like if you're just going to put yourself on the medication as opposed to needing it by asking your healthcare professional for one of these issues.
Yeah. You have to remember, when you're looking at all these outcomes and the studies, it is for individuals who meet the criteria for these medications.
Correct.
Whether we're talking about a GLP-1 for obesity, for weight management, or if you're talking about a GLP-1 for type 2 diabetes, or for blood sugar control. But what people aren't talking about is that so many people are self-prescribing these medications because you can get them online. I mean, we just read yesterday, right, that Costco is going to be selling GLP-1s. And they're going to be selling them for, now this, you know, I'm quoting it, but this is what was posted yesterday, for $499.
I read the article.
It's wild to me because I have patients in my practice who get GLP-1 online, not through Costco and not through a physician and not through a prescription.
There's a number of different outlets that are now selling it.
Right, and so those prices vary as well.
You get a routine questionnaire from a doctor online. You fill it out and it's on its way.
They don't ask for blood work. It's a very quick virtual phone call. I mean, at least in the experience with some of my patients.
I didn't see how Costco is going to do this yet.
Well, it's going to be for individuals who do not have medical coverage. That's all they're saying right now.
So more to come on that one, but you know, that's important to understand. Lastly, the one benefit is sleep apnea. Obviously, you lose weight. If you have sleep apnea, it's going to be improved. And what they showed in a 1-year study was that the apnea events are dropped, and the drop in oxygen is much less when you've lost the weight on the GLP. And then lastly, inflammation, which is of course, you know, your big bread and butter, and blood pressure are dropped at 1 year.
Yeah.
So those are big issues. But what about the consequences?
Well, there's quite a few.
There's quite a few.
And not every consequence is for every person, but we're going to take a quick break, and when we come back, we're going to talk about those next. Hey, it's Phil. Thanks for watching today's episode of Unfiltered. But before we go any further, I want to tell you a little bit about my book, Cracking the Food Code. If you're sick of diets that don't work, you can't get rid of your weight, bloated, etc., this is for you. I created this to teach you how to reset your metabolism, refuel your body with optimal nutrition, and rewire your brain. So what are you waiting for? Go to Amazon and get your copy today. So we're going to talk a little bit about some consequences of GLP-1. But I want you to remember, not every person is going to experience every one of these side effects or consequences that we're using. But it is important that you be aware of them.
And I've seen most in my practice, and you may have, your clients have complained about a number of them. We're going to talk about the gastrointestinal side effects. We're going to talk about muscle issues. We're going to talk about eye issues. And then we're going to talk about blood pressure issues a little bit, and also the malabsorption and the nutrient issues that that really plague it's so important to when you're dealing with this. So big one, GI. The most common issues are GI, usually about 44% in the studies that have been done. And we're talking about nausea and vomiting and diarrhea, constipation, or even abdominal pain. And listen, that's how the medication works, right? It slows down the gastric emptying. That's what it does. So that's why you feel full, and that's why you're not hungry.
Also slows down your appetite.
It slows down your appetite.
No appetite.
But some people can develop something called gastroparesis. That's like stomach paralysis, and to the point of even bowel obstruction. There are cases reported of bowel obstruction, or even aspiration. And this is really important in case those of you are out here. Why do you have to stop before you have anesthesia? Before a colonoscopy or an endoscopy, it's 1 week, and before any other surgery, it's now 2 weeks because of this one issue. So in case you didn't know, that's the issue at hand.
And we know that a lot of people who start this medication, they stop this medication anywhere between 6 and 14 months on average from starting it. And typically the side effects are why they're stopping the medication. 30 to 50% of the people who take a GLP-1 stop the medication within 1 year. A lot of times it also is cost prohibitive, right? So if your insurance is not covering it because you didn't meet the criteria for the medication and or you don't have insurance and paying out of pocket, that is also a huge
it's so important that you talk about this criteria.
I
think it's so important that you talk about not meeting criteria, because we're going to talk about that in our Get to Work section. So let's talk about muscle, because that's a big one. It's come out, it's literally in the medical reporting agency that you and I read regularly. We just literally got it yesterday. And we've been talking about it when preparing for this for you for a while now. Up to 40% of the weight loss might be from muscle, and it's not specifically lean body mass. That's the muscle and organs and water. So that's where it's coming from, and especially if there's no resistance or strength training done and no focus on protein intake. And you're going to really teach us that when we get to our section. So stay tuned, because that's so important. If you're on these medications, Phil's got something for you about that point. Take a balloon, okay? You blow it up, and if you put air in it, if you slowly let it out, that's fine. But what if you rapidly just let all the air out? It's got no structure and you can't fill it back up. This shows on the muscles, it shows in the skin, and it shows on the face.
I'm sure you've seen all the memes.
Okay, so this leads us to, and we have to we can't say the one name anymore. We have to just call it GLP face.
GLP
there was a name for it.
GLP face.
But again, when you lose fat rapidly, especially in your face, you're losing this plump cushion.
Some sagging, and for women, we get more gels.
Look at your Hollywood actors and actresses now, and you can. There's one famous actor that I saw. Oh, he is on a GLP. A popular, handsome guy. We were just watching a long series with him, and he lost so much weight. And I'm like, dude's on Ozempic. Still love him dearly. But what happens is you lose that plump skin, and again, it's like letting the air out of the balloon. The skin doesn't snap back. It just doesn't snap back. And it's really important to understand when you're older and use these drugs. So when you're 20, that's not a problem. But when you're 60, that's an issue.
You've lost your elasticity, you've lost the amount of collagen that you have in your 20s and 30s.
And what happens is you get the older than you look type face.
So a lot of people start medication for vanity reasons, right? Pardon me, but if they take it too far, then unfortunately they start to have the reverse effect. Too much weight loss, muscle wasting, etc.
So let's talk about eye issues, right? So there's major eye issues. We don't want to go crazy and scare everybody. One is retinopathy. People with diabetes, the retina is like a lens in the eye that is a special camera. The eye is your camera. This is a special lens. And when you have diabetes, you make new blood vessels, but these blood vessels are weak and can bleed. And when the sugar is uncontrolled, they get retinopathy and they can't see and they have blurred vision. Well, guess what? When you're on a GLP and you have diabetes and you have rapid weight loss, you can have more retinopathy. So you have to go to the eye doctor more and get checked more when you have this, especially if you have uncontrolled diabetes.
It's kind of like know your numbers, right? Get a baseline before you start.
And the latest one out there that's going to be studied, and that's why I say it's studied because it's not a black box warning or anything to worry about, is something called NAION, non-arteritic anterior ischemic optic neuropathy.
Don't worry
Say
about
that 10 times fast.
Don't worry
Basically,
about
your optic nerve is a messenger that sends signals to your brain so you can see. Now, what if there's insufficient blood flow? It's like a stroke. It's called an eye stroke. Sudden painless vision loss in your eye. So stay tuned, because that's being studied right now, in addition to something called macular degeneration. Wet macular degeneration is being looked at, all right? So those are things, they're under investigation, but they're not quite something you have to worry about.
You need to discuss taking these medications with your physician.
Yeah.
I have a client right now, very quickly, that she's taking a GLP-1 that she orders online, and when we've had the whole discussion about getting your blood work and talk to your doctor, and she didn't want to tell her doctor that she was on it. And my feeling is this: your doctor is your guide. They are there to support you. If you are taking this medication because you've self-prescribed it for yourself, or you've bought it in online or whatever it may be, you still need to talk to them, because you need to protect yourself from all those things.
Absolutely.
All the things that
Absolutely.
Dr. Scott just mentioned, that so that you You have to be able to have that conversation. And if you can't honestly tell your physician that you're taking this medication, then you might need a new physician if you don't feel like you can have that honest conversation.
I agree.
So, before you inject yourself, protect yourself. Talk with your doctor.
Protect yourself too.
Protect yourself.
Two small ones. One from my standpoint that I have to tell patients, whether they had bariatric surgery or whether they do your 30-day reboot or follow the cracking the food code and they lose weight just like I did, and it happened to me. Your blood pressure is going to drop. And if you're on medication, it's really going to drop. For every 1 pound you lose, you can lose 1 point in blood pressure. So I lost 40. My blood pressure tanked and I was on a medication. I was wondering why I was foggy and lightheaded and dizzy until I checked my blood pressure. So remember, if you're going to go on these and you're on medications, check yourself and protect yourself from that standpoint.
Exactly.
Lastly is the deficiencies. We get problems absorbing vitamins and everything. So I'm going to leave that one to you.
So we know that protein, right? Most people are not eating enough protein. So it's super important that you eat significantly, probably more than you did before, which is a challenge because remember, now we don't have the same appetite, right?
No.
So this is part of the problem. So the current research says that anywhere between 80 and 120 grams of protein per day. And if we really want to get specific, that's anywhere from 1.2 to 1.6 grams per kilogram. But again, this is where you talk with your healthcare provider and really make sure that you're meeting your particular
But wait, because again, we're going to get to this in our last section coming up. It's the type of protein they're eating, because they think, oh, we can eat whatever we want. And
well, it's not just protein, it's just the type of food. So people think if I take a GLP-1, I can eat any fast food I want, I can eat any junk. Quality is really important.
Quality is
right?
important.
So we'll talk a little bit about it. Your fiber intake is typically insufficient, so recommendations are 25 to 35 grams a day. B vitamins, so really important that you are animal proteins, fortified foods, or talk with your healthcare provider about a methylated B complex. Iron and zinc, again, lean meat.
But these are all the things that are lost sometimes when they're doing this. That's what I wanted to make sure.
It's not always lost as it is, it's just not
Trouble
eating
absorbing.
enough, right? And just not going to get enough in. The absorption comes in with the fat-soluble vitamins like A, D, E, and K. Added fat and bile flow is decreased because of motility, right? So that means how fast the food is moving through your system. Electrolytes.
But they can be iron deficient.
They can be iron deficient.
B deficient.
B deficient.
And can they be D deficient?
Yeah, they can.
Okay.
And
So-
I'm getting there.
Okay.
I'm getting there.
Okay.
Electrolytes, you can be insufficient,
Yeah.
but now there's electrolyte supplements. Just check the added sugar content. Coconut water is an amazing natural electrolyte, and omega-3 fatty acids. We really want to make sure
So all of these things,
all those things are
again,
in your diet.
We could even put this in our last section, but all of these things, these people need to have a list. And these are the things that they should make sure that they're supplementing themselves with when they go on GLP.
Some of the most important things, there's like a premium combo when you're on a GLP-1. Sufficient fiber, protein, and healthy fats.
Perfect.
And that is the best GLP-1 combo. And in my particular program, Phil's 30-Day Reboot, that is the premise of it. I mean, we talk very specifically about that because you want to naturally boost your GLP-1. And we can through diet. So, I mean, it is possible as well.
Well, so look, that brings us to get to work. So I really want you guys to understand that we don't want you to rely on these medications alone. They're a tool, but they're not a cure.
Correct.
Okay? So you have to have the proper diet, as Phil just showed you. You have to have the strength training, and you have to have metabolic monitoring your labs and doing all those things, following your physician and making sure that you have those deficiencies covered.
Yeah.
Okay? So, older patients, make sure you look at a bone density scan, make sure you're not having brittle bones when you're going on these and losing weight. And people are just going on them, as you said, without checking their electrolytes. Cardiac patients, you can get rhythm problems, so you have to make sure you get EKGs regularly, and you have to make sure you get your blood work regularly from that standpoint.
Your healthcare provider.
Again.
Please.
And then from my perspective, evaluate and reevaluate your need to take this long term, okay? I go through countless numbers. How long are you going to be on this? And when you get to your goal weight, what are you going to do? It's very simple. Avoid if you want a quick fix without making the lifestyle changes. If you're not going to change the diet and you're not going to change your exercise program, then it's not for you.
Well, wait a minute. that is part of the criteria. If you are
It
taking
is,
these drugs
but-
based on criteria, it is that you have tried modifying your diet, and that you are on a particular nutrition plan, and that you are incorporating moderate to
You have to track
intense,
everything.
I'm having a tongue tie. That you are tracking your physical activity
Correct.
as well.
You have to track that.
I think the most important thing is that you're honest with yourself, that you are doing those things and you are taking care of yourself and incorporating self-care. I know when a lot of patients sit in the chair with me, they're not really honest. You know, they're not specifically being dishonest, but they're not really ready to admit where they're at. And I meet them where they're at because that's super important. But you have to be honest with yourself, and you have to take care of these things in order to be healthy. I mean, you can't stay on these drugs, as you just said, indefinitely.
You can't.
And so you have to come up with a plan long term on how you're going to come off them.
I'm going to give an opposite. And if you stayed this long, I hope you hear this one. I had a husband and wife come in. They wanted to be screened because both their parents had heart disease. That's all they were in. They're both in their 40s. They're both skinny. They both have children. And they were both sitting there, and the young lady was sitting in the exam chair first. And I looked at her medications. She's just on a GLP. That's it. And I said, she's skinny. And I was like, why are you on this? And she said, straight as can be, we have a wedding coming up. And I went like this, you know, I went, no, that's not why you should do it. And she said, her reply was, well, I want to eat whatever I want. Okay, so those are the two things. When we're saying check yourself before you inject yourself, look at why you're on these. Look at why you're doing this. And as Phil said, be honest with yourself.
They're not so you can go to a wedding and eat anything you want. That's not what the medications were.
Yeah, so that's just my 2 cents worth. Look, bottom line is these medications are not magic, and they can be dangerous if you don't use them responsibly.
Absolutely.
Okay? You have to know the risks, and you have to take action and protect your gut, protect your heart, protect your muscles, protect your eyes when you use them.
Absolutely. Tell your doctor. I can't stress it enough. Please talk with your doctor, your healthcare professional, and let them know.
So please like us and subscribe to our channel, and tell everybody about this episode, especially anybody that's thinking about using GLPs or already on them. And we will see you for the next episode. And remember, if you keep doing the same things that you're doing, you're going to get the same results that you always get.
So if you want the health and life that you desire,
stop getting the health and life that you're avoiding, and let's get to work.
Hi, I'm Philippa Beddington, registered dietitian and integrative wellness specialist, and I am the creator of Phil Knows Food and the author of Cracking the Food Code.
Hi, I'm Dr. Scott. I've spent 30 years in the cardiac cath lab, and I am sick and tired of seeing preventable diseases not prevented.